pos and pregnant. What's the story? That's what we're talking about today on Plus Talk, where we turn positive into a plus, and two people who know a thing or two about it. Dr. Gina Brown, she's an obstetrician gynecologist and is joining the HIV team again at Gilead, and CiCi, who's the Senior Manager of Community Programs at the Well Project. Lovely to see you both, ladies.
Hello.
Wonderful
Hello.
to see you.
Thank you for doing this. We've got a lot to talk about: planning pregnancy, unexpected pregnancy, for when, either one or both parents are living with HIV. How important is the maternal viral load as a risk factor for transmission to a newborn?
Absolutely crucial. Years ago, I think about, it feels like yesterday, but it's also been quite a while. We recognize that when a mother has an undetectable viral load, that her risk of transmission is virtually nil. And so aiming for that undetectable viral load. Now, this is recognizing not all people can attain an undetectable viral load, in which case you want it to be as low as possible. But if it's an undetectable viral load, that influences what then happens with your infant at birth. So if it remains undetectable all the way through pregnancy, that's the ideal circumstance. There are some women who don't know that they have HIV until they're actually pregnant, and that's when they get their first test, and then that's your goal. There are also women who become infected with HIV through the course of their pregnancy, and so the American College of OBGYN, which sets up sort of guidances on how obstetricians practice and gynecologists practice, they set up a guideline that women should be tested again during pregnancy on or around between 28 and 32 weeks, because that gives you time to get her to an undetectable viral load if you then pick up a brand new HIV infection. And it also lets you plan how you would treat that infant or manage that infant after delivery if they're newly diagnosed, in which case you may use more than just one medication for weeks after, until you know that that infant is not HIV infected, as compared to someone who's been undetectable the entire pregnancy, in which case you can use just one medication.
So that leads me right into my next question. Does my baby have to go on HIV treatment? And if so, how long do they have to remain on it?
So if it's a very low risk infant, mother's been undetectable throughout her entire pregnancy, ideal circumstance, came into pregnancy undetectable, then she can take just one medication during labor and delivery. We keep them on their regular doses, but the infant would take AZT after delivery for 2 to 6 weeks. If she suppose she becomes HIV, she acquires HIV during the course of pregnancy, or acquires HIV toward the end of pregnancy, or walks in off the street not having been tested before and now is living with HIV while she's in labor, she gets treated, but the infant would also get started on a full treatment regimen until you recognize and are able to diagnose that that infant is not living with HIV. And that usually can be done within about 6 weeks or so after delivery.
For the purposes of this conversation, let's presume when I say I am planning, that I am, assigned female gender at birth, just so not to confuse you, and that I am living with HIV. If I'm living with HIV, I'm taking my meds, we want to get pregnant, do I have to change what meds I'm on? Are there different things? Does that all change, or does it remain the same?
So our preference always is an undetectable viral load. But if you're on a medication for which there isn't any real information about its safety in pregnancy, or if you're on a medication where there are questions about safety in pregnancy, the ideal circumstance before you actually get pregnant is to change that medication to something that has enough data, enough information, has an FDA approval for use in pregnancy, and then make sure that you remain undetectable during that time as you then plan on getting pregnant. That's an ideal circumstance. It doesn't always work that way. Often people will look up and realize that they are pregnant regardless of what medication they're on. And so we then have conversations about where they are in the pregnancy and whether or not it's worth actually changing the medications.
It's all about communicating with your doctor. What if I'm on HIV? What if I'm on the injectables for HIV? Is that okay to be pregnant on?
There is not enough information yet on injectables, the current available injectable agents, to say that it's, I don't want to say safe in pregnancy, but we like to have a certain amount of information before we recommend someone use that. It's not on the recommended list or on the alternative list under the current set of HIV guidelines, nor does it have an FDA recommendation or an FDA approval for use in pregnancy. That would be an ideal circumstance to switch someone's medication. The other thing that's important with those is you then might choose a different kind of a medication as the backbone, as the sort of not consistent, but sort of major drug that you're using with it. So instead of using what's called an integrase inhibitor or an INSTI, you might choose a protease inhibitor, because if someone has not been necessarily, they didn't always show up on time, or we know that there have been some episodes of resistance that have happened with someone who's been on the currently available injectable, we don't want to put them on another drug of that same class where they might develop resistance during pregnancy and the greater potential of having a drug that's not working well and passing the virus on to their child. So again, it's all about, if you can have that communication before someone gets pregnant, it's sort of the best circumstance ever.
Right. That's if you're planning. As we know, whoops-a-daisy, things happen. So, my partner is HIV positive and undetectable. I'm HIV negative, playing the female gender assigned at birth role here. Should I get on PrEP or treatment now that I'm pregnant?
So if you are not living with HIV at the moment, we have PrEP that works and works in women that's available for you to take while you're trying to get pregnant. So that would be the ideal circumstance. In this case, you wouldn't want to use the injectable, because if you then become pregnant on it, it's early enough in pregnancy. We don't have the data available regarding having enough pregnancies with that to know that it's okay to use. And so you would take an oral PrEP medication.
CiCi, what kind of conversations were you having with your doctors for your pregnancies?
Well, I had one of those unplanned pregnancies.
Whoops-a-daisy.
My
Which,
children
CiCi,
are
happens more than 50% of the time. Pregnancies are unplanned or unintended. Not that they're not wanted, but they're 50% of the time they're unplanned.
I'll tell you, my mother told me, she should never have said this, she told me she cried for a week when she found out she was pregnant with me. And let me tell you, I'm still in therapy for that. Anyway, CiCi, go ahead about your experiences in talking to your doctors about what was going on, because you were living with HIV.
My pregnancies are 11 years apart. So the first one, I was young enough, everything was new. Living with HIV was new. Motherhood was new, all of that. So I had 10 years to think about how it would be if it happened again, and it happened to happen again. So I knew the ways that I could advocate for myself. I was in close proximity to resources and providers and different women from the community who had experienced something that I wanted to experience so badly, which was breastfeeding. So I collected all of my resources and created a sort of safety net, a force field of support around me for me to be able to, make that decision on my own. And I think that it has to be explicit, is that it's not advocating for parents who are living with HIV to breastfeed. It's about not taking that choice away. And that's what I advocated for the entire time, was my freedom to choice.
Yeah, and doctor, it is important, obviously, to have that relationship with your medical care team. But CiCi, it's equally as important to have those conversations with your partner and your family and those around you, because that support is just as important, right, Doc?
No, absolutely. One of the things CiCi mentioned was this sense of community around her and building a community. And I think that's absolutely important. It's important for women and for anyone who's pregnant anyway, but it's also important for a person living with HIV to have a sense of community and community support, but also places where you can get additional information that may or may not be immediately available with the clinician who's taking care of you. I've had patients bring me information that I then go, look up, search out, get the data for, and can have a real conversation with them about it. They've gotten it from the communities that they circulate in, live in, that supports them. And it's also a very helpful thing to have those kinds of supports when you're on the outside. People, women who are breastfeeding, people who are pregnant, there are all kinds of boundaries that end up getting crossed for them with external folks. And it's important to have people around you who support you in this.
And we know that the Well Project is an amazing organization that does stuff just like that, right, CiCi?
Yes, the Well Project is a nonprofit that serves women and girls who are living with HIV and vulnerable to it across the gender spectrum. And this has been one of our programmings, BEBA it's called. We've been able to create resources and materials to get out to the community because although the guidelines have been updated, it's still going to take time and work for each and every person to be informed of what these changes are. So I'm so grateful to serve in the role of senior manager of community programs so that we can, continue to bridge that gap between folks who are living with HIV, their providers, and community.
Ladies, we have talked about a lot on this episode of Plus Talk, but I think we walk away from this conversation with really great news. If you're living with HIV and you know it or you don't know it, you can absolutely have a healthy, happy baby, and you can breastfeed them too if that is your choice. CiCi and Dr. Gina Brown, thank you so much for taking the time to chat with me today. It's been a real pleasure.
Thank you so much, CiCi. It's lovely to hear you.
Yes, it's so great to be here. Thank you for having me.
That's going to do it for this episode of Plus Talk. A lot of information. If you want more of it, just go to the website, pluslifemedia.com. And remember, you can follow, like, share. We are on social media at Plus Life Media. Until next time, take care of yourselves, be nice to one another. And if you've got a medical question, ask your doctor. See ya.